Hello, this is Dr. Ben Kumachiri. And so today's video is going to be focused on the question frequently asked by most of my patients. And this question is, most of my patients will ask me after surgery that, Doc, why is it that when I went to the operating room, I had so many people in the operating room during my operation just before I went under anesthesia, that is just before I was made to sleep. And so what patients should understand is that surgery is it's a team game. It's not just done by the surgeons or by the doctors. And so today I'm going to be introducing you, or I'm going to be making you understand the various team players that are involved in every surgical procedure and the uniqueness of cardiac surgery. So we will first of all start with the surgeons. The surgeon is the person that does the operation, and he mostly stands traditionally on the right side of the patient. And you also have the first assistant or the assistant, which could be a junior surgeon or could be a surgical resident. That means a medical doctor that is in the surgical training program. And depending on how complex the surgery is, we might have a second or a third assistant, which most of the time could either be a doctor or a medical student. We also have the scrub nurse, and this is a nurse that scrubs into the procedure. And this nurse is involved in making sure that the equipments needed by the surgeons are available. That means the nurse that gives the equipments to the surgeon when he needs. We also have the anesthesiologist, and this is a trained specialist, most of the time a medical doctor, or depending on the facility, a trained technician that helps in the making the patient sleep, if I may use the word, sedating the patient and making the patient relaxed for the procedure. So in the anesthesiology team, we might have the anesthesiologist and an assistant, depending on the hospital structure that we find ourselves in. We also have one very important member of the team, and that is the circulating nurse. The circulating nurse is a nurse or a technician who isn't scrubbed into the procedure, and he or she helps in sorting out instruments or equipments which are not available on the operating table. And this person works in collaboration with the operating team and the scrub nurse. Now, this is a traditional structure of most operations, be it general surgery, orthopedic surgery, neurosurgery. But now the uniqueness of cardiac surgery is that amongst all these players, we have one other important player, and this player is called the perfusionist. And this is a trained specialist in some facilities, is a trained doctor who focuses on managing the machine which we call the cardiopulmonary bypass machine. And in heart surgeries, we have to work on the heart which is stopped and dry. And so the cardiopulmonary bypass machine is a machine that takes the function of the heart and the lungs, permitting the cardiac surgeon to work on the heart. And this is a very, very important key member in cardiac surgery. And the details of the cardiopulmonary bypass machine is going to be brought to you on my subsequent videos. So in a nutshell, surgery is a team sport. It's not a one-man's play. It's a team sport. And that is why when you come as a patient into the operating room, you see so many people, and these people work together to ensure that the surgical outcome is a very good one. And so surgery is not one person's game. It's not just done by the surgeons or by the doctors. We also have a lot of people involved ensuring that you have successful surgery. So hoping to see you on subsequent videos on my Waspito page. Thank you so much.